Welcome to the Community Health Hero Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Today on Community Health Heroes, we'll be speaking with Dr. Sheen, allergist and immunologist with Children's and East Jefferson General Hospitals, who will talk about the symptoms and treatment of food allergies and how people should react with respect when someone says that they or a loved one has allergies. And in recognition of Mental Health Month, Logan Williamson, licensed professional counselor with Daughters of Charity Health Services of New Orleans, will talk about the state of mental health in our community. And on today's Eat Fit NOLA cooking segment, we'll be in the kitchen with Jennifer Duco, Director of Kitchen Operations for Caffe. So don't go away, we'll be right back with more Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on line.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
Hey, she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
When you have a hole in your neck, don't face the shower head.
Suction out your tube before you eat. Crouch. Don't bend over. You don't want to lose the food in your stomach. Don't use spray paint.
Be very careful shaving.
Welcome to the Community Health Hero Show. May is Food Allergy Action Month. Did you know that a food allergy reaction sends someone to the ER every 3 minutes? Friends, family, and coworkers can experience severe reactions to everyday foods like eggs, milk, shellfish, or nuts. Symptoms can include trouble breathing, low blood pressure. The most severe reactions can result in death. Join us today to talk about food allergies and how everyone in our community should react with respect when someone says that they have a food allergy is Dr. Sheen, allergist and immunologist with Children's and East Jefferson Hospitals. Dr. Sheen is also a member of the New Orleans Parish Medical Society. Welcome to the show, Dr. Sheen.
Thank you for asking me to be here.
Can you tell me a little bit about common allergies?
Well, common allergies are going to be food and inhalant allergens. And inhalant allergens are things like pollens from weeds, grasses, and trees, animal danders like dog and cat, cockroach, mouse, and molds.
Okay.
Foods are also a big problem, both young and old.
Are there any particular foods that one needs to be careful with if you have allergies, or is it broad?
There are a handful of foods that tend to cause more problems than others. Peanuts, tree nuts, milk, soybean, eggs, sometimes sesame, wheat.
That's interesting. So can you tell me what's the difference about children having allergies and adults having allergies?
Well, really, there's not much difference between a childhood allergy and an adult allergy. They both are inflammatory responses to common things in the environment.
And do you ever outgrow allergies?
1/3 get better, 1/3 get worse, 1/3 remain the same.
Oh my gosh.
So you, depending on whether your glass is half full or half empty, you're either 2/3 better or 2/3 worse. Allergies are caused by a problem in the immune system, and so you may have a child who may start off with a milk allergy, and if you wait and follow the life cycle of that individual, they may get better over time, and then when they are teenagers may start to have problems again, or they may not have had any problems at all, and then when we turn teenagers, they'll have problems. And you'll find people who have gone no problems at all until they're about 30. And these people have adult onset allergies.
Like no allergies as a child, as a teenager?
And then starting having problems when they're around 30. And then they'll get better for a while or get worse, and then you'll find them in advanced years, 50s and 60s, starting to have problems again. So you may have somebody who originally started off with frequent ear infections, then move on to nasal allergy problems, and then get better, and then you find out in their adult life they start having nasal allergy problems, or then in late life nasal allergy and respiratory allergy problems.
Do we know why age 30 seems to be a number that allergies may start at? Is there something special going on?
I think it's just as we advance in years, body parts don't tend to work as well as they might have worked in the past.
Is there anything we can do with either kids or adults to help make allergies better or prevent them?
Well, prevention is probably the best part, because avoidance of those things that can be avoided is an important part. Medications for what medications can do, and then immunotherapy for what that can do. Immunotherapy meaning allergy injections.
Okay.
So it's a three-prong approach.
That's really interesting. And is there a theme to this month's allergy month?
The Food Allergy Research Incorporated has been since about 1998 doing a food allergy month in May.
Okay.
And this year's theme is going to be react with respect.
React with respect.
Right. And what they want is they want people to recognize that food allergies are a serious problem, and when someone says to you, well, I have an allergy to peanuts, or I have an allergy to milk, or an allergy to eggs, that you respect that and do everything you can to have them avoid it, because it can be a life-threatening situation if they don't.
Absolutely.
So they're asking people to actually go online to the Food Allergy Research Educational Incorporated and take the pledge for React with Respect.
Well, that's a real interesting theme, though. I mean, you do sometimes hear people make light of it, but it can be life-threatening.
Absolutely. And it's very important to help these people along the way.
Now, it seems like this year's been especially hard on people with allergies. Is that just my perception, or is that reality?
That's reality in living in New Orleans. We have a very long pollen season. Trees actually start in late January, go all the way into May. Grasses start in mid-February and go into November. And then you have spring, summer, and fall weeds, and then indoor allergens like cockroach and mouse and dust mites.
All year
molds.
long?
All year long.
Oh, that's lovely. So, Dr. Sheen, can you tell me about the process a parent would have to go through to send their kid to school with either EpiPen or some other allergy medication?
Most schools require a form to be filled out by the parent and the physician, allowing the school nurse or the person in authority at school to administer an EpiPen should that be needed, or any other allergy medication, whether it be a bronchodilator or an antihistamine.
So it's really important probably this summer for parents with kids with allergies to get in to see their doctor.
Absolutely.
Because I know that summertime appointments are hard.
The summertime appointments are hard, and the earlier they get these forms, the better it is for the physician's office and for the school. That way they're not jammed up right when school is starting, trying to get all these forms filled out and bring them to the office at school.
That's a very excellent point. And you were talking about that pledge, the respect about allergies. Where would you go to find that or other information? Food
Allergy Research Educational Incorporated, and the website is foodallergy.org.
Foodallergy.org. And so what are a couple other websites?
The American College of Allergy, Asthma and Immunology, and the American Academy of Allergy and Immunology.
Awesome. I really appreciate you being on the show today and providing this valuable information.
Thank you for allowing me to be here.
When we return, we'll be talking about the mental health in our community with Logan Williamson from Daughters of Charity. So don't go away. We'll be right back with more Community Health Heroes.
Hi, I'm Kathy Ireland. I enjoy great careers in fashion, design, and business. The most important responsibilities to me are being a wife and mother to my family. We all need to be here for our families, so please let's do our best to stay healthy. And at my age, that means getting screened for colon cancer. Colon cancer claims the lives of 50,000 men and women each year, but it doesn't have to. Colon cancer can often be prevented or caught early through screening. If you are 50 or over, or have a family history of colon cancer, please talk with your doctor about getting screened. It could save your life. I got screened. Did you? For more information, please visit screenforcoloncancer.org. Thank you.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
You may have heard recently in the news that there were 3 suicides in St. Tammany Parish. 2 of them were high school students. Did you know that 1 in 5 Americans will be affected by mental health conditions in their lifetime? Join us today to talk about mental health, the impact it has on families and friends, and what you can do to help is Logan Williamson, licensed professional counselor, Daughters of Charity Health Services of New Orleans. Welcome to the show, Logan.
Thanks.
So can you tell me about the signs and symptoms of mental illness?
Sure. So, typically when we take a look at mental illness, we see that there's more of the chronic severe mental illness that we see in our communities, and then also the more mood disorders type, like depression and anxiety, which are more common. Mm-hmm. And those look like folks who are having a tough time with sadness, or their mood, their appetite, their sleep is affected. They have difficulty getting out of the house and participating in the community, along with anxiety and which looks like worry and that you can't really get rid of. It can escalate into things like panic attacks and things of that nature. We also don't want to forget about in our communities the problems folks have with substance abuse, so alcohol and drug addiction. That's really unfortunately a part of our community. But we include those folks when we talk about mental illness because we want to treat them and help them as opposed to incarcerate them.
Right. So. I saw that recently on the news that they're trying to help people rather than put them in jail.
Yeah.
So I thought that was a good movement. So can you tell me what kind of services Daughters of Charity offer?
Sure. We offer a wide variety of services. Okay. So Daughters of Charity primarily takes care of folks as a medical home. And so really that medical home is where folks go to see their doctor. And when they see their doctor and they complain about these things, depression, anxiety, substance abuse, their doctors are able to access the rest of our services for mental illness. And so one of those is through my role, which is a behavioral health care manager. And so when they tell that doctor that they're having a tough time, the doctor then will just give me a call, and I'll walk in and in that moment with the provider and with the patient and say, let's come up with a plan, a treatment plan that would be really helpful to you. And then that includes therapy, like coming to see me on a regular basis. It also might include psychiatry. And we have some other services too. We have including some help with the schools. So we have therapists that will go into the schools and provide mental health services to those children in need. And then as well, we also provide, and this is one of my favorite things to do, is we run groups for folks who have diabetes. And typically, diabetes is a chronic illness.
Right.
And it affects so many different people in so many different ways.
Absolutely.
And when we look at the folks who have a tough time moving towards health, they have a behavioral health issue, whether it's with them or whether it's an environmental thing that's going on at home. And so getting some
like
support.
home might not be supportive, or they may be trying to cook their food and have to cook for others.
Yeah, absolutely.
And get overwhelmed.
Right, or they're very, very stressed, and of course we know that stress can really impact health outcomes.
Absolutely. I think that's a great program. So it addresses not just their disease, but also some comorbidities with that.
Right, right, and it helps them move towards lowering those levels that affect outcomes for folks who have diabetes.
You had mentioned medical home, and I'm pretty sure not all our audience knows what that is. I do, but I think that that'd be really great to explain what that term means.
Yeah, sure. So a medical home is really with this core idea that the patient is at the center of care. And so when they come to one facility, they want to be able to access all the different things that they're going to need in order to take care of themselves. And so they're going to have access to their doctor, they're going to have access to maybe pharmacy or behavioral health services and other things that they're going to utilize in order to be healthy.
Awesome. And on the news, you often hear that the mental health in this area is not the best. Can you explain that to me? Like, is it really true, or is that just a misperception?
Right. I mean, I would say that we do have a high crime rate, and what I see is that a lot of folks who come into our office are coming because of the trauma that they're experiencing in the community. I'm not exactly sure about how, if we have a metric that says that we're more mentally ill than the next town over, but I certainly see that there's the violence in our community does have a significant impact that goes way beyond just that moment in time that happens, and so that's certainly a concern of mine. And then, and I think that we don't have enough providers in order to treat the folks who do have a problem, who need some help.
So you also are offering, I believe, at your program, a smoking cessation program. Can you tell me about that?
Sure. So the smoking cessation program is through the Smoking Cessation Trust that's been established from the lawsuit that was filed against the tobacco companies. And so we have these monies to spend, and we don't have all that much time left in order to spend it. But if you were smoking before 1988 and are a resident of Louisiana, then you can get services for free. And that includes counseling, that includes medication or the patches or gum and things like that are going to be assisting you towards stopping smoking. And really, I think it's a great service because folks need to have a partner in quitting instead of just sitting there cold turkey, staring at their empty ashtray and really wanting to fill it up. So.
And is that also including some group therapy if needed?
Yes, yes, absolutely. That's a really great component of it too, because the social aspect is really helpful for those who are looking to get some confirmation that they're doing a good job and to understand that there are relapses and quitting and strategies that other people are trying that are successful, and to get that from their peers who are going through that process at the same time.
And can you tell me about the locations? If our audience wanted to come find one of your locations, where would they go?
Yeah, we're all over the city. We have 9 locations.
Wow.
Really from Kenner to New Orleans East to Britannia to Carrollton and everywhere in between. And so we have a lot of different locations that we're trying to spread ourselves out for the community so that they don't have a tough time accessing us. They don't have to go to this one central big hospital. They can come and find a lot of our services that they need, those first level services.
Right there in the community?
Right there in the community.
Awesome. So would you go to a website or phone number?
Yeah, dcsno.org, and you can always Google us at Daughters of Charity Services.
Daughters of Charity, okay.
And if you want to give us a call and make an appointment, you can always call us at 504-207-3060.
Awesome. Yeah. Well, I really appreciate you taking your time out of your busy day to come here and share all this information with our audience.
Oh, it's my pleasure. Thank you.
When we return, we'll be speaking with Jennifer Duco, Director of Kitchen Operations for Caffe, when she joins us in the kitchen for another exciting Eat Fit NOLA cooking segment. So don't go away. We'll be right back with more Community Health Heroes.
2 outs with a runner on first base. Now the big guy comes up with that, hitting .342 with 92 RBIs and 36 homers.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away, Community Health Heroes will be right back.
How do we show our gratitude for our active duty military and veterans? The Disposable Heroes Project is a nonprofit organization serving all branches of the military and their families. Their mission is to recognize, honor, and support our veteran and active duty personnel in any form of assistance they may need. Visit dhproject.org now and donate or purchase merchandise to show your support. dhproject.org. It's your turn to serve.
Welcome back. Joining us for today's Eat Fit NOLA cooking segment is Jennifer Duco, Director of Kitchen Operations for Caffe, a local coffee house that also serves delicious and nutritious meals. Thank you so much for joining us on the show today, Jennifer.
Thank you for having me.
So can you tell me first, what are we going to be preparing today?
Yes, we're going to prepare our chicken salad, our signature chicken salad. In addition to that, I'm going to do the raspberry vinaigrette dressing that we serve with it.
Awesome. And so what Eat Fit NOLA cooking meals have you brought here today?
Today I have our tomato, onion, avocado salad. We serve that with a balsamic and olive oil.
All right.
This is our protein power salad.
Well,
that
that's
is served.
beautiful.
Thank you.
Very colorful.
Yes, it's delicious.
Some chicken and edamame. And what's this up front?
That's a smaller version of our entree item, the chipotle chicken wrap. And then this is the chicken salad with raspberry mint vinaigrette.
And what's in that chipotle? That sounds interesting.
In the chipotle chicken wrap, it's mixed greens with our chipotle mayo spread on it, and our chicken and Swiss cheese.
And that's Eat Fit NOLA too?
Yeah, absolutely.
Wow.
Yeah.
Now, how long have you been working with Eat Fit NOLA?
We've been working with Molly for a while, but officially our menu items came out about a month ago.
Oh, wow. And how many items do you have on the menu that
Seven.
are? 7 Eat Fit NOLA. Wow. And they all are beautiful, colorful, nice portions.
And so yummy.
All right. Well, let me get you cooking here.
All right. Well, for the chicken salad first, we prepare our chicken in-house every day. We cook it and clean it and chop it up ourselves. So that's the chicken there. And then
smells delicious.
Thank you. And we do the same with the celery. Get stalks of celery, clean it, cut it, chop it up. Some walnuts that we chop up. And then just some seasoning, a little salt, pepper, and a little bit of cayenne, a little bit of a kick in there.
Ooh.
And mayo. Mayonnaise to keep it all together. And we put that in there.
So you work with Molly on making the chicken salad Eat Fit NOLA, like low sodium. What did you have to do?
We didn't change our chicken salad.
Wow.
We just guide the customer to the right portion size.
Okay.
So you're getting our chicken salad. We didn't have to change it at all, which is really great.
Now, you did have to develop the dressing, though.
We did. We
Okay.
brought that on. That's a dressing that we created for Eat Fit NOLA. We, kind of toyed around with the idea of doing something with raspberry for a while, and then this came in, and it was a good opportunity for us to play with that. And people are loving it on its own. Somebody would come in and not even eat Fit NOLA and want the raspberry mint. So that's a good thing.
Awesome. So you're gonna
we just mix this together, just like I do every morning around 8 o'clock in the kitchen. And then the finished product, I'm just going to show you real quick. Looks like this. Right there.
It's beautiful, really healthy looking.
Oh
Smells delicious.
And it's so filling. And then this just goes on our we get heads of romaine lettuce every day. So we take the hearts of the romaine lettuce out and we put these aside for our Eat Fit NOLA dishes that we send out. And this is served with the raspberry mint vinaigrette as an entree.
Which you're going to make for us right now.
Which I'm going to make
awesome.
for you.
The smells so good. It smells really fresh.
It is. Everything's fresh every day. We get there 6 a.m., a whole bunch of us come in, we start cooking for everybody every day.
So also tell me a little bit about Caffe. People want more than coffee from the coffee house. So how did that happen?
We found that out early on. We've been there for 24 years. I was there
when you were two.
Yeah, no. In high school, a little high school girl. But we used to only serve lunch till 3 o'clock, and we thought about, hey, people probably want dinner. So we started doing more of a, meatballs and spaghetti kind of dinner. That's not what people wanted. They wanted to eat healthy. They wanted the salads.
Wow.
So very early on, we found that out about our customer base, and we've been so successful with it ever since. And we serve till 8 p.m. At the Clearview location.
Wow.
So it's really been
This
great.
this raspberry stuff smells so good.
Isn't it fantastic? This raspberry blush vinegar. It's really
beautiful.
fantastic. For the dressing, what we do is we start with the pomace olive oil.
Okay.
Right there. And this is so easy. You don't even need equipment. You need a whisk and a bowl. I mean, come on, it's so
You
easy.
can do this at home.
You can do this yourself. And the raspberry blush vinegar goes in next. And then a little bit of honey.
Tiny bit of honey.
For some sweetness there.
But not too much.
Not too much, not too much, but you don't need.
Right.
You know, you don't need a lot. You just need a little bit. The mint that we chop fresh. It's
too.
fresh mint. You got to have fresh mint. And then we also add the swerve. You know, instead of sugar, we're using the swerve. It's a product that Molly introduced to us, and it's fantastic. It's really great. Oh my gosh, it smells so good. Okay, so really all you do is that, and then you whisk it together. You don't want to over whisk.
So you don't want to over whisk this, you just want to gently whisk it?
Do not over whisk it. It'll emulsify with the oil and it'll get too thick. So you want it to stay more of like a vinaigrette.
And how much of this do you serve with the chicken salad?
We serve a 2-ounce portion. Get about 19 of those.
Wow.
Out of a batch of dressing.
Wow.
Yeah, so it's really great.
I was really curious about some of these other foods. So we made the chicken salad and the dressing, and you told me a little bit about what's in the chipotle sandwich. Tell me some more. This is so beautiful and colorful. What do we call this?
That's our protein power salad. We serve it on a bed of mixed greens with almonds, toasted almonds, edamame, some cherry tomatoes, and then our sliced grilled chicken that we do every day.
This is grilled chicken in this dish.
And we do that every day in-house.
And what dressing comes with this?
That's the raspberry vinaigrette.
Wow, that's beautiful. And what do we have here on the far left?
This is our tomato, onion, avocado salad. That's on green leaf lettuce.
Ooh, it smells good.
Oh, it's great. And then we have the sliced tomatoes on that, red onions, feta cheese, grilled chicken, and the avocado. And this is our balsamic and extra virgin olive oil.
Wow,
and
that's a nice portion too.
It is a nice portion, and for this menu, you can switch out these two dressings.
Okay.
With either salad. They taste good with either salad, and you're still Eat Fit Nola.
That's a huge bowl.
We love our bowls.
Well, thank you so much for being on the show today and sharing
you.
these nutritious and delicious meals with
Thanks
us.
for having me. It was a good time.
All right, we'll be right back with more Community Health Heroes.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
You and your team are a machine. But what happens when your team loses their coach? Your game falls apart. 1 in 5 African American men will be diagnosed with prostate cancer. Facing cancer alone is like a game without a coach. That's why coaches from over 30 collegiate conferences want you to have a plan. OnTheLine.com. Find the prostate cancer information that lets you stay in the game. OnTheLine.com. Because your health is on the line.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards.
Oh, don't. Oh.
It went into Bob and Carol's yard. Oh, no? Okay, here it comes.
Oh, Mom!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you. Search We Can for more ideas on how you and your kids can get healthy together.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit Nola restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. You can also find us on YouTube. We hope that the information we provided today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and we'll see you next time on Community Health Heroes.